The American Heart Association says heart disease is the #1 killer of women, and doctors say the warning signs don't always look the way you expect. One Virginia Beach woman says she knows that firsthand, and now she's sharing her story alongside a Sentara cardiologist with a message that could save lives. Deanna Smith says she thought she knew what a heart emergency looked like until it happened to her.
January of '08, I had a heart attack. They couldn't figure out why because I had no blockages.
After breast cancer treatment, Smith says she started getting short of breath, then one day collapsed.
And my whole body gave way.
Doctors finding an ascending aortic aneurysm, the same condition Smith says took her father. She underwent surgery and now undergoes heart scans every 6 months, using her story to remind other women not to ignore unusual symptoms.
A lot of women think, oh, I'm going through the change of life, that's why I'm sweating so bad. I was burning up. I was profusely sweating and not understanding why. And then I started throwing up everywhere. And that's when I knew.
Her cardiologist, Dr. Matthew Summers, runs Sentara's structural heart program, specializing in minimally invasive heart valve procedures and emergency stents.
Nowadays, the majority of those patients can be very safely taken care of with procedures through the inside of the blood vessels instead of cutting the breastbone and opening the chest.
He says women may experience less typical symptoms like shortness of breath.
There may not be as much premonitory or foreboding symptoms leading up to an ultimate coronary syndrome or a heart attack.
And even recent tests can create a false sense of security.
That doesn't mean that everything is okay now if you have new symptoms. We want the opportunity to help people before they get sick, before they get in the 11th hour of their disease process.
A message Smith says she now shares every chance she gets.
Get an EKG. Go in and get a CT scan. It's worth your life. It costs you nothing. But it can cost you everything if you don't. And Dr. Summers is also part of the team that's bringing a new non-surgical heart valve replacement to Virginia through a clinical trial. He urges patients to see a primary care provider if anything feels new or worse with activity, and ask whether heart testing is appropriate. Email me if you know a person or group making a mark in Hampton Roads. I want to tell their story.